I'm caught up in the game. My attention is on every play and every whistle. But what I'm missing is a signal coming from my kidneys. That signal isn't like a ref's whistle. It's more of a silent SOS, which could be warning me of an increased risk for events like heart attack or stroke. And a way I can catch that signal? A simple urine test called UACR. If you have type 2 diabetes or high blood pressure, talk to your doctor about the UACR test. Detect the SOS. Visit detectthesos.com to learn more.
Booze and banter.
Hi, Frank.
Hey, Roman, how are you?
I'm doing great.
Merry pre-Christmas, this is?
Right before Christmas. And what a great episode to have before Christmas with our friend Adam.
You know, I really want to shake hand also because I've heard a lot about you for a long time, and I'm glad to finally meet you.
Yeah,
I appreciate that, and I know that you guys bring some really amazing people on. I'm just happy to be here. Thanks for inviting me.
Yeah.
Of course. I've known Adam for several years. I don't know exactly. I love what you've built, and I'm excited for you to talk about it. And finally, I've been trying to get you here. I know you've been so busy.
I know. I think we all have.
Yeah, but I got other ideas in mind that we can do with your
He
practice.
says other ideas means money.
Oh,
Right?
God, it just gives me tingles.
Don't worry. First, I want to say thank you to Big Oyster Brewing Company for sponsoring this episode. And Frank also had this.
Yeah, so the Babe Brew from the our trip to Delaware, right?
Yep.
And this is
When they launched it.
This is the Raspberry Peach Cheesecake Sour, 7% ABV. So I pre-gamed to that. These guys did not because they're less man than me. But that's what we pre-gamed with, so we'll send a shout out to them.
Yes. So let's get into Adam. Tell everybody who
No, we're not going to get into Adam.
Ah.
Let's talk about Adam.
God damn it. This fucking guy. All right, go ahead, Adam.
I mean, I was just getting excited. So
need a cigarette
and you just
already?
took it away from me, Roman.
Okay, go ahead.
You leave me speechless.
Get into it. Go ahead.
Well, my name is Adam Ruszkowski. I have a physical therapy clinic in Jamesville, New York. I've been a sports-oriented PT for, probably 13, 14 years now. I'm also a strength and conditioning specialist, a sports performance consultant, and I've spent a short time in professional sports and have built this clinic in Jamesville now. And I'm really happy to serve the population down there and providing a service that's quite different than what normal physical therapy actually is. And one of our missions probably one of our main missions is to change the way that people view physical therapy and turn it around, that it's not just something that you can do or experience in the presence of injury. But I'm sure everybody has heard about the longevity craze and trying to optimize the human experience. And we're really queued up very nicely to be able to do that as a profession. But I feel that we're not taking advantage of that as we should be. And I designed my business to provide that opportunity, not only to help people overcome their presence of injury and their low mental state from that and all of the sequelae that's associated with that, but also to empower them that this journey is lifelong and to live a strong, healthy, confident life and achieve their goals, and not only just achieve them, but often surpass them. And I'm really fortunate to have a really solid group of patients and continue to get new patients every day. Very humbled by their trust that they allow us to work with them.
Mm-hmm. I wanted to get you here for a long time because how unique your practice is. And honestly, I've played sports, I've had injuries, did my recoveries, with physical therapies. What you've built, I've never seen or heard before. And that's why I feel like people need to know about it and get better explanation from you of what you do, how it works, why you're doing it, the future of it. Because people ask me, is ARO good? I said,
Is what good? I'm sorry?
ARO Physical Therapy is...
Is that the name of your company?
Yeah, it is. So it's interesting because there was a whole kind of thing with New York State. Developing a business in New York is not the easiest thing.
Sure.
And one of the things that we have an endurance coaching consultation company, and my wife's actually the head coach for co-head coach for the National Interscholastic Cycling Race Team called the CNY Sharks.
Fantastic, yeah.
By which, if you're interested, they have their annual giving, and they're always looking to raise some money to support the kids to provide a self-efficacy, confidence, collaboration, cooperation, and teamwork in the form of getting more kids on bikes. Mm-hmm. And it's a nationwide thing. She actually works for Nike National, and she's the director of community outreach, and she's extremely passionate about riding bike, racing, and providing the best experience for these kids as possible. Mm-hmm. So they're out there doing that. If you want to contribute to their endeavor, wherever you are in the country, chances are there is a Nike affiliate there, and encourage you to support these kids, because we're trying to get them outside on bikes, away from phones, away from tablets, getting out there, being physical, and learn how to have adventure through physical exertion. So it's really cool.
So is this NIKA?
NICA.
Okay. Yeah.
Yep.
Okay.
NICA.
Nice.
Yep.
And you cycle too, right?
Yeah. So we both compete in ultra endurance mountain biking. Mm-hmm. I also dabble in ultra endurance running, trail running, duathlon. I do a bunch of crazy shit.
Mm-hmm.
Nice.
Yeah.
So I would tell people when they ask me, is that physical therapy good? I say I drive 45 minutes, so Adam can work on my plantar fasciitis. And you also did
what a pain in the ass.
Achilles tendonitis.
It's actually a pain in the foot, Frank.
Yeah, no. Yeah. Well, because my foot's in his ass.
I'll tell you what's pain in the ass is sciatic pain.
Yeah,
which you've also worked on.
There's not a lie. I see those every day.
I showed up one time. He had me wrapped up like a pretzel on the table. And all his patients are looking. He goes, Roman, you like that?
So do you do I know you're not a chiropractor, but do you do that sort of thing? Like you can release subluxations and shit like this, or?
Well, it depends on how you classify it and what you're talking about. So we utilize a specific assessment program to assess the way that people respond to different forces upon the body. So you bring up the example of a low back situation. So if people come in with low back pain or pain that's into the leg, maybe referred pain, maybe radicular pain, which is a bit of difference. So radicular pain is usually on a specific nerve pathway that's impacting the musculature or has some sort of muscular weakness component and also a sensory component that's associated with it from a neural compression at a specific level. Mm. So we can classify that, and we can apply different loading strategies to the segments to assess response. So ultimately, with the goal of bringing the sensation out of the leg, move it towards the midline of the body, and have it stabilize there. So not only that, but we're empowering the patient to be able to do these movements, these specific movements, so that they can handle the sensations on their own. So there's an element of self-efficacy there versus relying on the provider to apply forces. So I have some really good friends that are chiropractors. Yeah. They have a different niche than I do, yep. But we just address those problems at a different level.
Yep.
Yeah, I like the attention to detail in the recovery period as well. I like how you explain everything, and so that I understand how my muscles work, how my recovery works, and what I should look out for and work on when I'm not there, when I'm at home, and hopefully not sticking to the program you gave me to work on.
It's right. There's ultimately an element of consistency there, but you bring up something important, and that is being able to walk with a patient down the recovery journey and performance journey versus disseminating a bunch of information to them that they may not pick up. Mm-hmm. So the goal is to educate, inform, but listen. So the principal thing is to be able to listen to your patient, because if you are sitting in that assessment room and you are doing more than talking, and you're not allowing them to contribute as much as they should, and you're already spinning in your mind possibilities of differential diagnoses inside that room, you are missing things. Mm-hmm. And what's happening is that you are utilizing your own paradigm or your own biasy before the patient is already is disseminated all the information that they feel is important, because you're not actively listening, mm-hmm. because your mind is someplace else. And one of the biggest things that was one of the mistakes that I made when I was a young provider is that I was thinking about what I'm going to do with this person before I would finish this assessment. Instead of figuring out, okay, based on what they're telling me, what in life are aggravating factors? What are they doing to make it feel better? When did it come on? How did it come on? And how we can work together to either modify those life factors so that we can say, okay, well, this is the modification we're going to make in life. Here are some of the tests that we're going to do, and then retest our hypotheses to see, does it make a change? What are your limiters that are contributing to this condition so we can make it go away together on the long term? Because what happens is that most often is that you take the information, at least this is what I've seen and I've experienced, from different facilities. So you go in, you'll have a discussion. They will have either some sort of pre-cooked idea of what you're going to do. You'll go in, they won't take any measurements. There's going to be no minimal to any objective data accumulation. They will give you your stuff to do, and you will leave.
So it's like making a game plan without watching game film.
Exactly.
Yeah.
It's a great analogy, right? So for us, I'm a big believer on understanding what matters, measure what matters, and change what matters. So if you're not necessarily taking the data, you can't manage that.
Right.
If you're not measuring, you can't manage it.
But you're willing to adapt accordingly if you have to.
Well,
you're not hard and fast on what you have to do. You will make it work according to the situation.
No, it's like driving a square peg into a round hole. Yeah. It's like if you have a specific treatment paradigm that you're married to, you're going to have a certain population that fits into that.
Yep.
For sure. You will have partial responders and then you have non-responders. But you'll still try to pull that into those non-responders, and if they don't fit that,
that's right,
they'll be discharged. Yep. Okay, and then did they fail physical therapy? I don't think so. Right. No. They failed your method. But what'll happen is they're going to go back to the doctor and say, I failed physical therapy, and now I want a Juven care, and that Juven care is in the realm of possible surgical intervention, a pharmaceutical management, or otherwise. Or they're going to go to a different place.
That's interesting.
They're going to get a different thing, and they'll be like, oh my God, like it's the same thing.
Yeah.
And they get really disheartened because they feel that they are not being heard. So for example, it was the other day, right? So I have a patient that comes in. She got lateral knee pain. And side knee pain, people always talk about like iliotibial band friction or iliotibial band syndrome for lateral knee pain. In this case, this is what she was convinced she had, right? So we go in, we take her information, right? We sit down and say, okay, what's been going on? Okay, I get this raging lateral knee pain. I can't get on the treadmill. It hurts, right? Get on the elliptical, hurts like a bastard. I can't do it. I'm trying to be active, trying to move. I'm on my feet all day. It really, really bothers me. It's been bothering me for years. I'm like, okay, all right. So what else do I need to know about your condition that you haven't told me? Oh, by the way, I fractured my ankle in 2014.
All that matters for sure. Yeah.
Okay. So she tells me in 2014 she fractured her ankle. I'm like, when did it start? A year later. I'm like, okay. So now, not only that, I'm not. Most people will stop at the hip, right? Oh, it's got to be the hip. I check the range of motion of the knee, check the meniscus, check the ligaments. Cool, right? Goes back in, right? She got 0 degrees of ankle range of motion. So what does that mean? Okay, well, it means her knee's going to find a way to function, right? So consequently, when she's walking around being on her feet all day, or when she's doing thousands of reps on the elliptical, or she's walking on the treadmill, or she's doing a bunch of different things, her knee's going to track differently. So that's going to lead into a malposition and just a change in the way these tissues are loading and transmitting forces. So guess what? Nobody has addressed, even though she has told them that this is part of my issue. I think it's my ankle because I fractured my ankle. Nobody even looked at it. First day.
Yeah.
Right? I'm like, okay, perfect. We're going to address this. We're going to address your hip strength because it's down. We're going to pull it up. We're going to see if we can offload this a little bit. And then we're going to send you on your way. She doesn't stick around with places because she doesn't feel heard.
So how long was that whatever you call it.
It was one day.
So she saw you one day,
She saw me one
and
day.
that was it.
So yeah,
And now she's back to.
Well, she's going to come back. She hasn't. completely
Oh,
healed
okay,
up.
okay.
But the fact of the matter is, we're addressing
Yeah.
her limitations
Yep.
that people haven't addressed before.
But this long-term problem, you think you can potentially fix in like a month or so, 2 months, whatever it is?
Oh yeah, I think it'd be faster than that.
Yeah.
But the thing about it is, pain is an experience.
Yep.
Right. So it's not just a physiological, mechanical construct. It's a physiological underpinnings of how the brain picks up. We call it nociceptive information, or it's things that are basically diverge from normal. Say, okay, the body says, okay, well, is this a normal thing? Yeah. Is this not a normal thing? So there's nerves that go to the brain. The brain says, okay, is this normal? Is this abnormal? It comes back down the system in the form of pain, right? So if you have chronic, long-standing pain, it is not, usually it's associated with an inflammatory state, but in those conditions, the inflammation is gone because the body's really good at healing itself. However, the brain remembers these experiences. So if you stimulate tissue that was once painful and you haven't necessarily built up capacity or built up the safety around the brain saying that this is no longer a painful experience, then the brain, it will continue to hurt, even outside the presence of tissue damage. So you don't necessarily have to have tissue damage to elicit a pain provocation. And that's when we talk about a biological, psychological, and social construct of how pain is experienced. So you can have stress, you can have a physiological, like an acute injury. Okay, I sprained my ankle yesterday, I blow up, have a lot of inflammation. But what about the pain that's been long-standing? I've had pain for years. All the inflammation's gone. Why does it still bother me? Because apparently you still stimulate those sensitized tissues, but you're not necessarily providing the environment to help the brain desensitize itself. So there's a lot of different things that are associated with the pain syndrome because people aren't crazy. That people understand what they're experiencing, but a lot of times it is pushed aside or disregarded because of people that are malingering or things like that. These are judgments that are made on the person.
Or I'm getting old or something like that.
Oh, yeah. Yeah, so, this is the way this is supposed to be. I'm aging. I'm like, it doesn't have to be that way, brother.
Mm-hmm. No, and then when they have that pain, they're dealing with it, the body's compensating and creates stress on other joints.
Yeah.
And then that's another problem you got to come in and take care of. But like you said, if you don't listen to the history of everything that happened, even going further back, you understand better. Why is this pain here? Like if you strain your ankle on your left foot, why is your right knee hurting so much? Well, because you're compensating. But I like that it's important to know those details to address it.
Yeah, you know what else, Roman? We measure it, right? Mm-hmm. So we use sophisticated technology to be able to take this information and then put numbers to it.
Can we go into that? I love equipment in your place. A lot of physical.
And you love technology, you fucking weird.
A lot of. Yeah. What's wrong with that?
Nothing. It's a lot.
Aren't you glad you got a techie person to call
I'm okay problems? With it today. I'm learning.
So, you go a lot of physical therapy practices. It's limited technology equipment, right? Yours is like state of the art. Like, can you just tell people about what you have?
So let's start with when your name is on the door and you have a specific philosophy and you feel like we can change the trajectory of where physical therapy is. So you're battling on a couple of different fronts. One, you're battling a status quo. Two, we know that we need to take information and take advantage of the way technology is advancing because otherwise you'll be behind. We know that in the medical model, you're going to have some sort of value-based care system that will be coming down the pike. And what does that mean? It's like, okay, well, there's associated value for what you do. Well, what is value? Is it going to be how fast you can get people to a specific outcome? Is it going to be a bundled-based pay situation where you're paid X amount of dollars for a specific condition? And if you go over that, then it's on your money, your dollar. There's a lot of different things to consider when you're talking about acquiring technology. So another avenue is learning curve. Are you able to effectively assimilate new technology into your clinic workflow Or do you not want to do that because you're says, okay, well, if it ain't broke, don't fix it. But even though it might be like, all right, we get good outcomes, but are you taking these net provider rating scores? Are you getting reviews? Are you polling your patients? Are you getting subjective patient outcome questionnaires?
Collecting data.
Yeah. Are you looking at that, or do you feel like they don't come back to you because they've gotten better? Which isn't the case. I've got a person in my clinic right now. So they literally told their therapist that they've gotten better just so they can be discharged to go someplace else.
It's interesting. We have a lot of these people on our podcast, a lot of business owners, a lot of people. But the passion, right? The passion you have is supersedes any kind of dollar amount threshold. Like, you're not in it. I mean, everybody's got to make money. You do. It's your job. Yep. But your primary concern is making sure that your client is taken care of, and you're there for the long haul. Not just get in, get paid, get out. And it's a pretty common theme for a lot of people we talk to, and it's and I'm sure that's the majority of people at least in our country are that way. But there are people that are not. But it's interesting to see that not interesting. I would suspect that's the way you were going to be. I wasn't thinking that you were going to be anything other than that. But it's nice to hear, right?
In care, the outcome of patients is like the foundation of your reputation. You have bad outcome with your patients, that foundation crumbles. You have cracks.
Yeah, you burn your pizza, no one's coming back.
Right. But when you have patients that leave your practice and feel like, you know what, I'm healed. Like, I don't have to lie and say, oh, I'm feeling better so I can go somewhere else. You have someone who will drive 45 minutes to get better because the outcomes, there's actual definitive result in the outcome. It's not some bullshit. I'm like, oh yeah, I'm going to go there.
And just giving a shit, like, really. Yeah. I mean, just caring is 75% of it.
Oh, people can see right through that.
Yep.
Right.
Yep.
If you're just in like a number, right, you say, okay, well, I'm going to get you in. You got 30 minutes. A lot of time, it's unfortunate because I know we're taking a little bit of a divergence from what we were talking about before.
We can't go back and forth.
So there are a lot of places that corporate entities are buying and turning it into a money-making model. So, for example, I will see you and I will work with you until and I will provide you the service that I feel like you need, not bound by time or units to my insurance company. I get paid X amount of dollars depending on what insurance company you have. But because I care about you, our foundational values are to effectively over-deliver on a consistent basis. Well, people will say, oh, well, that's ridiculous because you don't get paid for it. But again, you understand where we are with relationship to who we are caring for. We're providing a solution to somebody's problem that is affecting their lifestyle, how they live, how they want to move, and what they want to do in life. So they are investing their trust and their time and their willingness to adopt to a training program that you design to get them back to the things they love to do, whether it be ultra endurance mountain biking, ultra endurance running, road running, lifting my grandkids, lifting blocks in the yard, gardening, taking care of a loved one, multiple things, right? But when you adapt, at least in my eyes, we have a performance physical therapy model. And what does that mean? Well, it doesn't mean that we're just associated with athletes. However, we treat everybody like they're an athlete. And it doesn't mean that we're overbearing and we push them really hard. It's a planned progression that is individualized approach with identifiable limiters and measured limiters that we can modify and change so that we take that type of model and apply it to everyone. And it gets us superior outcomes because we're taking the information, we're applying the information, we're regularly checking the information, we're communicating that back to the patient, and they understand where they're going. Mm-hmm. Most often not, you'll go into a place and you're not in alignment. The first thing you need to establish is therapeutic alliance with your patient. And you can be a great therapist, a great person, very personable. But if you haven't established a clear pathway of which you're going to travel in a direction and set your beacon, it's going to be very difficult for people to buy into your plan of care. Because if you just give them the same sheet that you give everybody else, they're going to know it. And they're going to know it really quickly. And if you're still doing it after 3 weeks, then you're doing them a disservice.
Yeah.
Right?
Because people know their sheet.
I do know their sheet. Because I got the same sheet from the person down the street.
But to clarify, you can be in your 20s or maybe slightly younger. You could be in your 60s. You don't have to be an athlete.
No.
You are going to treat everybody according to what they need to be treated for.
Right. But think about it like this too, right? So everybody knows the term longevity, right? You listen to Peter Attia. He's kind of ubiquitous throughout the podcasting world, longevity specialist. You know, there's many people that are talking about this. But there's certain qualities that you need to establish in order to live the best life you can, preserve muscle mass, improve your nutritional quality, improve your cardiovascular conditioning in order to maximize the last decade of your life. So I take his approach and say, listen, what are the 5 things that you want to be able to do in your last decade of your life? And what are you doing today to enable yourself to be able to do that?
Sure.
So it could be the fact that I want to be able to climb stairs independently. I want to be able to live in my house until I die. I want to be able to play with my grandkids and have the fruit of and being able to enjoy those lifetime moments and those life moments with my kids and my grandkids. I don't want to be relegated to a house or have them come visit me in a nursing home, long-term care facility, because I didn't necessarily have the strength. I mean, this is barring other massive things, because bad things happen to people. It significantly changes the course and trajectory of your life. But I'm talking about, if we're going to control the controllables and take those things off the table, what are you doing now to be able to live the best life you can, as healthfully as you can, to maximize the time that you have here on this planet?
Yeah.
Because it is finite.
Yep.
And we talked about this a second ago. So like back in the way I structure the business. So you guys are familiar with Simon Sinek?
No.
Okay. So Simon Sinek is a tremendous, he's author of Find Your Why and the Infinite Game. And he has a great podcast called with the Optimism Group. He brings on amazing people, business owners, corporate leaders, to see how they manage and lead people. Not even manage people, how to lead people, how to lead groups, how to empower groups, how to not necessarily look on the short term, but look on the long term, and not the finite, but play the infinite game. And the way that I'm structuring the business is along the infinite game. Because you are not going to win the game of healthcare. What you will do is you're able to influence many, many people down the road. But if your main goal is to dollars and cents, the healthcare community, you run into like United Healthcares. You run into all these different institutions that take advantage of you, make millions and billions of dollars every year, while people are spending $2,500 a month on healthcare.
Right.
Because and people can't afford it.
Yep.
So what we're trying to accomplish is that we're trying to provide a superior service so that people will tell their friends, they'll send their family members. I can't tell you how many families I see, like the entire family.
And for you, it's a living. Like you're not this corporate entity trying to make millions and billions. You know, you're making a living off of it, and you're satisfying what you need to do to live comfortably. Also taking care of the people that you're helping to do that.
I love doing it.
You're not trying to satisfy a shareholder.
No.
You are the shareholder.
Exactly.
Yep.
Right. So, and hopefully I get to share that as we continue to grow in the community. But ultimately the plan is to develop a health system that Central New York is not seeing.
Yeah.
And really to kind of drop providers in that are of the same mindset. So I'm looking for quality people. Like when I go through a hiring process, I'm not looking for warm bodies.
Yeah.
I'm hiring people who have the same core values that we do, and then are at least skilled providers.
Yep.
But even if they're not, if they have those values and they are willing to learn and willing to kind of step outside their comfort zone, because what we do is difficult, Frank. This is a different type of thought process. When we go in to assess people don't have the time for this because they haven't built it into their system.
Yeah.
But we want people that are willing to take the next step to say, okay, this is where I feel our profession is going, to leverage technology to make better clinical decisions and follow ourselves to superior outcomes.
Yep. Yep.
Yeah. And I watch you as a leader in the practice there, how you jump around, keeping an eye on things.
How he kisses your head, right?
Yeah, my bald head.
I'll tell you what, it's amazing.
He'll come,
He's got the stub on there. Like,
I'll walk into his practice. He's like, Roman, come here. And he hugs you and he holds me there.
so what are you, 6'2", 6'3"?
Yeah, I'm about 6'3", but I tell you, I can't tell you, like whatever beard oil that Roman uses, it's like I'll tell you what, it's like an aphrodisiac.
Nothing.
But it's got
Nothing
to like
today.
stain your shirt. You cook an egg on it later or something.
No, but I also love, you have this whole pneumatic equipment that uses, air instead of loud weights and bulky equipment.
So you had like a big ass compressor somewhere?
Yeah, it's in the ceiling.
Yeah. Okay.
Ask me how it got there.
Was it Roman?
Yes, it was. We were both there. Yeah.
Both up on a ceiling there, mounting it, even adding shock absorbers.
Did you use a come along?
No.
Yeah, it was me.
Come on.
Come along. Come along and help me.
This way, Adam.
That's right.
Yeah.
Well, that's why he's 6'3", so he can get it up.
Yeah, we had
Because you're only like 17 inches from the ceiling anyway. Right?
we had
on the ladder.
a huge ass scaffold in there. Yeah. Right? Yeah.
Yeah, we got it on the scaffolding, off the scaffolding, onto the ceiling. But we created the shark absorbers out of rubberized.
Oh, the vibration isolators? Yeah.
Yeah, because the compressor is not that loud. It's not like your traditional construction site compressor. It's like, wow,
Well, like not like a big ass Ingersoll
It's
Rand.
nice, quiet, belt driven.
Okay.
A very quiet machine. It's also hidden in the ceiling, above like acoustic tiles, and so you hear a little bit. But I mean, that one compressor. How many machines do you have on that?
Let's see.
At least 15.
What do you got, copper piped everywhere?
No, it's actually it's just air hose.
Oh, okay.
Yeah, it's special.
Yeah, there's a main line. There's a main line. I think it's like 1/4 inch, and it drops out in like 8
Oh, with a
inches.
manifold? You got a manifold?
No, they're just they're shut-off valves at the compressor, and then there's a main line which is thicker. It's about 1/4 inch, and then offshoots of that are to each machine inside the wall, and then you have a wall plug for your air. And what's nice is this machine doesn't need to have all these bulky weights. You just plug that in, and you have these plus and minus buttons on it.
Yeah.
And it's hydraulic, right?
That's great.
Well, it's air. It's
Air,
It's
and
pneumatic.
it's got that's right.
Yeah,
Pneumatic.
Shout out to Kaiser Performance Equipment.
Oh, yeah, I'm familiar with that. Yeah.
Yeah, so Kaiser's been around since the 80s.
Yep.
So initially they were talking about, okay, well, how can we move in any direction with any force and as fast as we want or as slow as we want. So it's super customizable. You
You guys continue.
you're not moving weight per se. You're not moving iron, but these things can move along super smoothly. So what does that do? It makes it more comfortable for the patient. It allows them to have a consistent level of resistance over the course of the motion and make it more predictable. So in that realm, so then we can say, okay, we can start from a very light and very controlled velocity and build you up to the needs of whatever your goals are in your rehab process. So you're not necessarily overcoming a significant amount of inertia or load on the front end to push. It's very consistent, and you can move it at a great deal of speed, create a significant amount of power. And well, why is that important? Because one, it's safety, it's controllable, and three, as you age, you lose power. You lose your ability to move force fast. And the variety of equipment that I have, and the way that we use it to address certain conditions and certain limitations and certain performance indicators is is something you'll find in basically like the NFL, the MLB, all of these companies have it, high performance institutions. And we are bringing that technology, which is extremely unique, to outpatient orthopedics in central New York.
I love it. The precision, the ease of use, the safety of it. I feel like those machines are safer than what you use in the gym with steel plates and stuff like that. It's also something that, say for example, someone's older and maybe they don't have a good back or good leg strength to maybe pick up some of these weights to put on the machine to be able to do the exercise, but they can press that button. It's easier for them to be able to adjust weight without worrying about getting hurt while trying to adjust that weight.
Oh, it's a learning curve.
Yeah,
because I can adjust start and end positions. I can adjust leg position. I can say, okay, well, here's what we're going to do. We're going to stay within this effort level, because the readouts it gives you is not only resistance, it's percentage of your power. So what we do is that we can either program off of effort, how hard you feel you're working, or off a percentage of what your peak power can be. So we measure that. So like there's no way to get more precise than that.
Yeah.
It's like either we take a number and we work off a number and say, listen, when you drop below like 90%, you're done with your set. Okay. So now they know they've got to work hard. So I'm really big on biofeedback. So listen, either I'm going to put a sensor on you to see how hard your muscle's working, how much neurological activity is going to it to bring awareness to it, or we're going to work on wattage and output measure, or we're going to take a look at, okay, here I am on a sensor. Here, what I'm going to do, I'm going to put you on a surfboard and you're going to work on your balance and collect these coins, because it becomes more engaging with it. We're going to put you on a balance board. We're going to have you hit pods while you're balancing, or as you do an agility task, you're going to call out colors and numbers. All these different things challenge the neurocognitive aspect of it because it's not addressed in a rehab. And these things are just coming out in research, right? So we know that as soon as somebody has a divergent attention, their motor control reduces. Same thing. What happens when people fall? Why do old people fall? Why do aging people fall? It's because either they're dual tasking, and all of a sudden they don't pick up their foot. And then all of a sudden they don't have the lower extremity power to be able to move their limb quick enough to be able to take a recovery step. I did the research when I was in PT school, my doctorate degree, presented in the World Congress in Physical Therapy back in Amsterdam. I'll tell you what. Speaking of that, we went to the Heineken Brewery there, and I'll tell you what. I tasted
at Amsterdam.
Yeah. That's where it's from, right? So I went to the Heineken Brewery, and I had Heineken in the United States, right? I'm like, okay. I was like, Heineken is amazing coming out of the tap, right out of the brewery. I'm like, I couldn't believe it.
Yeah.
Right. But,
versus here.
Yeah.
Yeah, it's different. It's different.
Yeah. Well, the water quality is different.
There's a difference though. Like he's thinking about that. I'm thinking like red light district.
Well, it's interesting.
Interesting. That's where Heineken is.
Yeah.
No, but water quality in beer, and we had somebody on the podcast discussing water quality in our homes and what we consume. So was the owner of X Gym, PJ, and we talked about it's good they're putting all the treatment in the water, but once it comes out of the tap, we don't need to consume all the chlorine and stuff like that. Filter it out right there. It's better for your body.
So do you use a water filtration system? Because I see these things popping up around social media a lot.
After our recent discussion, I'm putting one in.
I use one coming into the house.
Oh, do you?
Yeah.
So how much does it filter out?
I don't know. I mean, I put
depends on the filtration system.
Yeah, you can get different filters, 20 micron, all this.
Yeah.
I think that's probably what mine is. It's a 20-inch filter. It's a sort of polypropylene, encased in this blue housing with a softener, but it's all filtered prior to coming in the house. But like Rome was saying, PJ said you should filter it right at the tap. But I don't know if that's for a system like mine or if that's for a system off of municipal water, because I'm on a well. Okay,
so it's a little bit different, right? So I think there's this like on counter system. I think it's called Aurora, And
Under the counter?
No, it goes right on top.
Oh, yeah.
So it's
yeah.
like this kind of cool thing. You
Yeah.
go back in. It kind of looks like this kegerator right here.
Yeah.
But
That's
like,
what it is. That's a water.
It's definitely filtered
it's
water.
filtering
right?
beer.
90% filtration right there.
Goes in water, comes out beer. No, but I know what you're talking about. They're similar to what your refrigerator uses. It's basically what's the black stuff?
Carbon.
The charcoal filtration system
Yep.
that you put in your refrigerator. It's same thing, just goes on that little knob thing at your faucet and just filters water through there. So yeah, those are not as so. The guy that recommended on our podcast is one of those the 3 filtration systems. What did he call that?
Yeah, I can't remember. Not RO, is it?
Oh, maybe it is RO.
Yeah.
Yeah. So it's basically
Reverse osmosis.
Okay, yeah.
yeah the 3 filtration system you put right underneath your countertop with a separate tap that comes out of the drill a hole. Put
It's
that
like the thing you have at the dentist office when you like rinse.
Yeah.
All right.
That's what it looks like. He's like, those are best right there on demand. So I'd probably put something like this, or I'll put more elaborative filtration system right at the main coming into the house. And it's, little.
And then once he does that, he could do it for us.
Oh, yeah, for sure.
Cool. Thanks, Roman.
Yeah, right next to the main tap, boom, right there. You know what? That's what I need,
I'll
right?
do all the research.
Because we had this thing that kind of screwed on to our main tap. And it kind
Your
of,
water fountain filters has the filter.
Yeah, it does. Yep. Yep. So I mean that works really well with those. But at home, we screwed it on the tap, and it just takes a long time to kind of fill it up a little bit. I'd rather have one for like dishes and the other one. Yeah, but that's
sure.
That's your next day.
Thanks, Roman. You're such a good
That's our
friend.
next thing.
Thank you. We both thank you.
Let me
So Roman's a specialist in putting this in. So if you need him, so he will come in.
let me experiment on my own home
Have
first.
beer will travel, right?
Mention Brews and Banner, you get a 35% discount.
You get 100% discount.
No.
Our motto is have beer will travel, right?
Actually, I saw this prank these friends did with this one guy. He went out of town, and I think his wife was in on it. They went out of town. His buddies came into the house and replumbed his house, entire water system, so to run off a keg. So he went to open the faucet, and the fucking beer was coming out. He's like, "What the hell?" He opens his shower, beer is coming out. Everywhere he opened,
beer shower be great, man.
beer was coming out of all the faucets. He's like, "What the hell is going on?" He goes under his house. He's like, "What the fuck is going on here?" And then where the basement, he's got all these kegs that the water lines were attached to. And his friends came out, like flush the toilet, beer comes out. I thought it was really funny. Can you imagine?
Yeah, it's almost
That's an expensive prank.
It's a lot of fucking beer.
it is, but I'm kind of like, that's a pretty damn good idea.
Or wine. Have
Whatever.
a separate tab.
Like
for
wine is all of a sudden you pull the tap, all of a sudden it's like red wine. You're like, oh my god!
Yeah, I don't want to flush the toilet. I'm pissing and there's red coming on my.
You can call me Jesus.
Guys, like, oh, is that happening again?
I thought it was. I need more
my
penicillin. Like, remember that? I need more Calgon. I need more penicillin.
God, I'm not eating that many cranberries.
or
You urinary tract infection? Again?
another thing does is beads. When you have beads,
What kind of beads, Roman?
red beads.
Oh, anal beads or something.
No, it could give you red coming out of your ass.
So do beets, but like Jesus, what are we talking
Yeah,
about?
well, Roman's like talking about like golf ball beads.
No, man. Vegetable. They're
Yours only,
vegetables, right?
yours only touch the edges, right?
Beads.
Oh,
Veg-
beets. Oh,
yeah.
beets. Yes.
Yeah.
Oh, beads. Okay.
What do you think?
I thought you
I thought
said
it's beads.
No.
Like anal beads.
No.
I was with you.
I mean, depending on the size, I'm sure that
Right.
could be.
Golf balls wouldn't even touch Roman's edges. Like you wouldn't even know it's there.
then,
You can slide in and out. And I mean,
then Frank is going to need physical therapy.
That's not the kind of physical therapy I do. There's specialists for that. I mean, I know a couple of people if you need some help.
I'm sure you've been through some shit, right?
He'll refer you.
Yeah, yeah.
I'll refer you for that one.
But I love your facility. Like I said, equipment is awesome. When you step away, we're talking about the whole pneumatic system. And
No, I was here for that piece of it, but then isn't there like some room for expansion here? Like, you growing?
Yeah, so let's go back to some other equipment. So as far as like diagnostic equipment, we use IMU sensors, inertial movement sensors. So they're basically 3 planes of motion. So they sense kind of rotation. They're magnetometers. They point north, so they're able to do it. And they also pick up accelerations. So what we can do is that for anybody, because these assessments aren't necessarily just athlete specific, they're movement specific. Because most people, for instance, if you're a first responder and you're carrying down like 50 pounds of gear on your back, or an air tank if you're a firefighter, coming downstairs, you got to be able to do single leg squats. You got to be able to come down. You got to be able to stabilize on one leg. You got to have ankle range of motion. You got to have front and side plank stability. You got to be able to squat well, right? So, and sometimes you got to be able to hop, right? If you're rock hopping, coming over the top of different things. So we can measure the amount of stability that you have per rep, how much movement you have, and link it to quality and compare it between side to side. So we do that. We give people a comprehensive report along with a corresponding strength and force plate measurements. So not only do we get quality of movement, how well you're able to stabilize your body, the endurance you're able to have through your trunk, we're able to quantify an output on the force plates, see what your balance is on single leg, double leg, how well you can hop, how well you can rebound, how much force you produce, and then take it one step further and then break it out and say, okay, well, we measure segmental systems with a hand dynamometer. So not only this is all recorded in a handheld app. Mm-hmm. So you get it right there. You can put in your pocket. So any data you've got it. It's right there. You can reference it anytime. You want to show your doctor, it's right there. So all of these things are basically analyzed and distilled down into your note so that we can build your treatment programs from them. Mm-hmm. And I guarantee you there is nobody around here in this area that is doing that much of detail to see where your limiters are.
Yeah.
Mm-hmm. Because again, we're taking a spotlight, right, and narrowing it down to a laser beam on what your individual needs are. And then we go from there. So then we attack the things that your problems are. And are we moving, not only that, are we moving the needle effectively and timely on those metrics that we deem appropriate? And if we're not,
then you can just weed it out, right?
Yeah, Frank. That's what I tell people all the time. It's like I'm sitting there. I call it the bullshit detector. Mm-hmm. You know why I love using it? Because it challenges my biases and it challenged my ideas.
But you want that.
Exactly.
Yeah, exactly.
I want that. But you know what? Some people don't.
Yeah.
Because this is the way that I do it, Frank. And if it doesn't work, then it must be you. It might not be me.
Yeah.
Right? But you know what? I push that hubris aside. I say, listen, I want you to prove me wrong because I will learn something in that environment.
Absolutely.
All of a sudden, so why don't you respond to this? Oh, it's a little different. Or are you moving like this? Why? And if we take the minutes to take it and say, listen to it, learn from it, then we can help people. Because there are so many people that walk through our door that are like, wow, this is insane. Yeah. Like I've never had anything like this
before. And a lot of
before.
people have never done it before. Right.
Right. But this is the status quo. And this is why we're different. Because we're utilizing all of this leverage technology to make better decisions to help more people. But not only help more people, help them more precisely. Because instead of just taking things and throwing exercises at people and people getting better just in spite of what we do, is that we are utilizing the top ends of our license so that we can help more people and help them better and get them not only back, but get them beyond where they expected to be.
Mm-hmm. Yeah, and what a success story if you can come in with a problem as a client and they can leave
patient.
Patient.
So be a client too, and we'll talk about why we're going to talk about.
But if you can leave that place in a better situation, like not only solving the concern you came in with, but in a better position than you were beforehand. Like what better success is that, right? For something that maybe you didn't, it's just as a result or as a sort of byproduct, it's a benefit of what they came in to get treated for.
Oh yeah. So not only is my back and leg pain gone, I feel I might be able to do this. Yeah. I look at what I could do. I didn't even think I could do this. Yeah. Right. And there's so many people that have those same stories. I'll give you an example. I had a couple of people training for the Marine Corps Marathon. Right. One woman comes in, she has raging leg pain, right? She can lift her leg up to about 30 degrees because she had tension on her nerve, right? And she had lateral knee pain. She couldn't run. Wow. She could barely walk down the stairs. She's got to go to the Marine Corps Marathon in like less than a month, right? She comes in, right? She works, right? I think it was probably like 8 weeks. She works, right? She works at what we're talking about. She follows a treatment plan, right? we're making movements on one area. She's still getting this leg pain, this side knee pain, right? We just pivoted a little bit on that specific aspect. That goes away. She goes and fulfills her goal of the Marine Corps Marathon. So she went from not walking to going and running the Marine Corps Marathon.
Yeah. Right. Fantastic year.
My goal is to do that one year.
You should, but just gotta get your foot right.
Yeah. My foot actually has been a lot better.
That's good.
I haven't been. The only time I feel it is, and I've narrowed this down. The only time that pain comes back is when I'm not wearing boots and I'm on the ladder for too long.
Yeah.
Like wearing sneakers,
We all got foot
not barefoot.
problems. Foot problems suck, man.
Oh, they do, because you can't take a rest, right?
Yeah.
So speaking of foot problems, right? Another patient. So this has been going on. So plays soccer, right? Going to go to college, right? She every time she would run and scrimmage in a game, she like her lateral leg would get sore. Like she was going to the doctor for possible compartment syndrome, which is bad news. So what's compartment syndrome? So inside your leg and inside in the muscles of the body, there's these fibrous layers of tissue called fascia. So fascia is basically relatively inelastic, but it has a lot of nerve endings there. So in the lower leg, there's 3 compartments. One houses your bone, your tibia. You have the lateral compartment, which is your perineal muscles, the one that pull your feet out. And then you have the posterior compartment, which is your calf muscles, right? So what would happen is that every time she would run or initiate distance running, she'd get this raging lateral leg pain that would have to take her down, right? She would come in, she'd have to rest, she'd have to take these multiple breaks. So she was not operating optimally. We go through, we take this assessment, right? Before, this is like one thing, because she was going to go in and have a pressure sensor taken. So the way that you actually diagnose this is you take a pressure gauge, you put it inside the compartment, and it takes a level of pressure.
Inside how? What do you mean inside how?
So they take a needle.
Okay, yeah.
Take a pressure needle.
So subdermal, yeah.
Yeah, so subdermal needle inside of where the muscle is, and they measure the pressure inside of the compartment. So as you move, the pressure will increase, basically causing a lack of blood flow to the area, and ultimately necrotic tissue, and the tissue will die. So bad news, and usually you have to go in and release it. Huge surgical procedure, miserable. And so she's like, well, we don't know what to do. This has been going on for a couple of years. I'm going to go back and run. Can't run. So I couldn't run a turkey trot, right, for as long as I could remember, right? So she comes and she sees me. We identify. We take a look. Say, this is what I think is going on. She comes back over Thanksgiving. She runs a turkey trot with her dad for 5K. So I can't remember the last time I did that.
Nice.
I'm like,
Nice,
and she wasn't able to run at all. For
Right.
she was able to run, but like not distance. All of a sudden, and she's a teenager. She's like, this is great.
Yep.
Right? Unbelievable. Like I was like third stop on the train for her.
Right.
Right.
Yeah, it's just identifying correctly. And so where do you stand on the whole holistic piece? Is that anything you do? I mean, we're both obviously in technology, and science doesn't lie, right? I've always said that science does not lie.
Yeah.
And that's what you can get from that. But holistically, it's hard to sort of measure a science piece of that.
So break that down for me. As far as like holistically, are you talking about nutrition, psychological, all of that kind of thing?
Like these, what do you see? These people that wear the, copper knee pad or shit like this, like magnetic magnets and stuff. These kind of things.
I'll tell you what. If you feel like it's moving the needle for you, then by all means.
But it's not something that you.
So I say I want you to go get a copper fit knee brace.
Copper fit, yeah.
Not really.
Yeah.
It's not really one of my go-tos.
Right.
But there are different types of wearables, per se, that can move the needle, that have reasonable science that are behind it.
But different strokes for different folks. I guess,
For
right?
sure.
Yeah.
So I'm a very cynical person. So I'm not going to recommend anything that I don't feel is like super niche that I haven't tried myself. Mm-hmm. But one of the things that we will do, I think mindfulness meditation is significant. I think that psychological stress does significantly contribute to pain syndromes and chronic pain. I think that introducing people on how to effectively breathe and to not that they don't breathe effectively. I think that they can optimize their breathing patterns to effectively calm their nervous systems, which is basically a fundamental tenet of mindfulness and meditation practice. So I've taken like 10 minutes in the middle of my day. I just put my earpods in, take my Aura ring, right? Pop on the app, right? And sit there and just kind of like calm my mind for a little bit so I can get ready for the next set of patients.
Yep.
I think that's significant. I think that you don't necessarily need niche gear if you're not checking the boxes.
No.
So let's talk about the boxes, right? If you're not properly hydrating, if you're not properly mitigating and mindful about your stress, if you're overworking yourself, if your nutrition is poor, if you're not getting adequate sleep, anywhere from 7 to 9 hours in sleep at night, if you're not checking the boxes and you're not regularly exercising,
Yep.
those are the boxes that you need to do versus just like I'm gonna go take like I'm gonna go up a supplement.
Right.
You can start talking about getting yourself on a consistent supplement routine if you've already checked the boxes.
It's not in place of, it's in addition to.
Exactly.
Mm-hmm.
They are supplements and they call that for a reason. And you got to go for a reputable source. Right. So if you're not checking the boxes for health, that the easiest things you can do, get out and do, because 25% of the population meets the recommended guidelines for exercise that's put out by the World Health Organization.
And it's the minimum guide.
25%.
Right.
Yeah.
Yep.
Right. And it's not like we're talking about like 150 minutes of mild to moderate physical activity from a cardiovascular perspective and lifting 3 days a week for 30 minutes.
Yeah.
Resistance training.
Yeah.
It is not something that's like above and beyond. If you can get a lot of zone twos that have been out there, like moderate aerobic activity that's sustained for upwards of 300 minutes, like you're golden, right? That's a great thing. That's getting out there and walking. You got 30 minutes of walking a day, right? Like getting out there brisk walking, getting out there and moving, lifting something heavy with it. It doesn't have to be, it can be like 20 minutes. It could be 10 minutes. Just get out there and move your body and apply some load so your body can adapt to it. Do you know why we talk about this? Because the two biggest bangers for your longevity is what your maximal oxygen consumption is. People call it VO2 max.
Yeah.
So how much oxygen you can utilize per milliliter per kilogram a minute per your body weight, and what your muscle mass is. So the larger your muscles are, the longer you will be able to sustain a healthy lifespan.
Yeah, because I got a huge muscle. You know that, Roman.
Yeah. So your VO2 levels?
No, it just fills with blood.
It's just blood flow.
I can't. I'm like Beaker from the Muppets. I can't even blink. I'm like no skin.
You know what they say when people talk about that?
Other people are jealous.
Usually opposite.
So right. So you're talking about like okay, well, systemic inflammation that's housed inside body fat. So reducing body fat, not only just we're talking about visceral body fat that's around your organs that basically constricts your organ function, right? And we're talking about subcutaneous fat, right? So you can do identifying
what's subcutaneous fat?
Just like the stuff that's underneath your skin.
Oh, okay.
Like for guys, they tend to hang out around their bellies.
Yeah, that's exactly what mine is.
Women around their hips, things like that. So that can be associated with metabolic disturbances and improper endocrine balances. So hormonal balances and things like that. A lot of people aren't getting effective blood paneling done to address some of these issues. And even if they do, they go to the providers and that's not being addressed, being overlooked because you got about 3 minutes with your provider.
Right.
So having the ability to talk with somebody that'll sit you down, go through a comprehensive panel and check on what's going on under the hood is extremely important. Like for me, right? I do 100-mile mountain bike races, right? I was pre-diabetic a year ago, right? I couldn't lose body fat no matter how hard I tried. I wasn't on a bad diet, but I wasn't the best one. There's no reason why I couldn't lose anything. I was depressed. My mind was clouded. And I was not nearly as productive as I am right now. And my confidence has come back. I made a significant life turn. I changed company as I was dealing with, and now I'm working. I've got a tremendous plan in place, and I feel better. I feel like I'm 25 years old again. Good. I'm able to focus because turning that around, like, you don't know how shitty you feel until you actually start feeling good.
Yeah.
So people acquiesce to the thing like, oh my God, I'm tired. I can't think at the end of the day. No, that is a cue of your body saying you got to do something about it. It is ringing alarm bells saying, listen, if you're feeling like that, that is not what you should be feeling. Mm-hmm. Like, I'm 41 and I can attest to you right now that you could change this. Mm-hmm. You do not have to feel that way. And what we're trying to do, and Frank, you alluded to expanding and building, our goal is to create an ecosystem, a health ecosystem in this area that people have not seen before, to bring a big city feel into this area and to provide an opportunity for people to feel better, move better, be more confident, be stronger, and live their best life. Mm-hmm. And that's what I'm after. And if people want to come in and get on the train and trust us with their care, they will not be disappointed.
You mentioned difference between patient and client. Mm-hmm. So patients are those who referred by physicians and then client is more like, I'm an athlete. I want to, because we talked about this, you do this for like teams, for example. Yep. I'm an athlete, and let's say I'm a tennis player. I come to you for my base numbers. We put together a plan. What do I need as a tennis player to improve in?
Right, for sure. So you ultimately you come in, you get a comprehensive assessment. We'd address limiters, right? We would say, okay, well, here's what you need to do, what you need to address. We identify those low-hanging fruit and prioritize them, and provide you a plan to be able to address those limiters. Mm-hmm. So, and then what will happen is that based on that information, they did a comprehensive report. Here's where it is. Here's your baseline numbers. Here's your program. So we put the program into our app. So you can on your tablet, on your phone, you have access to it. Mm-hmm. You have it for life, right? It's right there. Nice. You can communicate through us through the app, right? If you want to come in, you can schedule an appointment right there, and as well as some other things. So we partnered up with some like a nutritional company, and we have other specific things that we recommend. That's basically on the our information page there, and you can get oversight from afar. And I've done that too. So for instance, I was volunteering at the bike race that we do in Michigan. It's called the Margie Gessick. So I was working on the team to do that. I was standing at one of the road crossings, and I don't know how we got talking about it, but she told me that she couldn't participate on the duathlon, which is badass crazy because it's like I did it a couple of years ago. It's a 65-mile mountain bike, and then you got to run 45 miles after that.
Wow.
So in one day, and you got about 28 hours to do it, and it's pretty challenging. And this is the Upper Peninsula of Michigan, and you think there's no
Traverse City area?
Well, it's actually in the like Traverse. You got to go over the bridge and all the way to Marquette.
Yeah. Okay.
Yeah. So it's an
I lived in Michigan for a little bit.
Yeah, it's an iron ore territory, and there's some rowdy mountain biking out there. It is the most beautiful place I've ever seen. Nice. So Lake Superior is like
it's beautiful,
it's majestic, and it's just incredible. It's one of my favorite places on the planet. And we got talking about how she tore her Achilles, and here's what she's doing. So I'm literally working with her. She's in Michigan, and she's sending me videos here, and I'm saying here, I would do this, I would do this, I would do this based on what you're showing me in the videos. Mm-hmm. So I help people. I provide access. So if you want access, right, you pay a monthly fee. I charge people $50, right? You come in, you want access. You send me videos. You tell me what's going on. I'll write you a program. You communicate me through the app. You write me an email when you need to. And basically, you're on a retainer, just whatever you need. Yeah. Like if you need to come in, then you come in, right? Then it becomes okay. There's an additional fee because you're taking up time. Yeah. But that being said, we're giving opportunities for people from afar to come in and be able to take advantage of just the knowledge. And not only that, we're providing people that want to come in and get assessed superior information and direction on which to complement their existing exercise programs. So people come in and they'll have a generic program and they'll do group training. There's more than enough. There's quality strength coaches around the area. But what happens is that once you get about like 15 to 20 people in a room, it's challenging to coach them.
Yeah.
So they tend to have, and it's difficult to kind of individualize some of that. You'll have like, well, you do this instead of this type of thing. However, in that type of environment, it's very difficult to take effective measurements and individualize. So they will come in, they're often trained with somebody else. They'll come in, they'll get assessed. I'll say, here's what you need in addition to what you're doing to give you the best possible outcome. So when you do this is what you're going to do, right? Yeah. So I'll give them their modifications and I'll give them their progressions of which to do certain things, either in the program or in addition to. And I have no problem talking to coaches.
Yeah. Adam, I didn't even know that. I love it. I love the fact that you can remotely help somebody and you have this app for $50 a month. I mean, you get a lot for $50 a month. That's great.
Oh, that's not so it's you get so it's basically the app that we utilize for our home exercise programs. So it's not like you just plug and play. It's not like you'd say, okay, like it's not as sophisticated as like an AI generated exercise program. You tell me how many days you want. Here's what you like to do. Yeah. It's not like that.
No, but it's access to you.
Yeah.
Right? It's a remote access to you.
Yeah.
Is what I'm saying. And, like you said, you're paying for the knowledge, the experience, and guidance. And let's say you have a client remotely, and can they go to a local qualified, let's say, a qualified physical therapy practice that is reputable and aligned with your vision that you're willing to have them go because they're away, get their base numbers there to then work with you?
Well, it's interesting because there are not a lot of places that actually provide the services I provide. So it's interesting because as a profession, we struggle on just taking basic muscle numbers. People don't take ranges of motion. And I'm talking about pneumatic power equipment that give me wattages, outputs from force plate analysis, comprehensive strength measurements, functional tests that give me specific numbers that I can see how well you produce and absorb force and how you organize your body.
Yeah, it's complex.
They can't get people to take a number with a dynamometer on their hand, and because people don't want to invest in that type of technology.
I see.
So you see, like, well, hey, I want you. So can you go get a force plate analysis, and I'll tell you what to do.
That's tough.
It's like nobody has force plates. You're talking about like a lab. You're talking about labs,
Right. You can have a lab, right?
Huh?
You can have a lab.
I'm putting a lab in.
In your existing space?
Yeah.
I love that idea. That's
yeah. So it's gonna be our performance lab. So where we do our testing is going to be the lab. I'm going to name it a lab technically. So it'll be part.
I'm definitely going to take advantage of that, become the client, and we'll talk about areas I want to advance.
If people look at my shirt, they know I do. So
I'm going to tell you, you have a jacked Santa right there.
Check Santa drinking beer while it's spilling on the snow.
That's what you're saying. Well, that's after he's delivered all the good little boys and good little girls and products.
That's after you already are all the fat.
This is after the AR.
Yeah, that's after the AR.
That's right. He's got some of those Deltoids.
Another reindeer outdoors.
You need before and after Santa, before and back, after at the front.
No, he is missing his mouth with that bottle.
Yeah, he's not seasoned.
Adam, you mentioned the water ring earlier, and you have one on, right?
Yeah.
So we've had a guest on the podcast. We talked about like biohacking and how to make exercises are interesting and then jump back on the wagon. And what are your thoughts on? Would you ask any of your clients or patients to, if they have any of the data, to send it to you just because it's some numbers you wouldn't really collect in the practice?
Voluntarily?
Oh, 100%.
Yeah.
Yeah. So
Useful data.
yeah, for sure.
So
So
how do you sleep? You have this many hours of deep sleep or this many hours? You know, what's your activity levels and stuff like that you can collect from your device.
yeah, I mean, most people wear Whoop. Most people wear Aura. Those are the two large. Yeah, Whoop. It's like, yeah.
What race?
But also, so like my Garmin Phoenix 7 does a really good job, and they pretty much light up. So I take all that, right?
Mm-hmm.
So how much do you time you spend in deep sleep, right? Or you like or REM sleep? How well like your quality of sleep, how long you're sleeping, what's your sleep latency, what's your heart rate variability, how well are you recovering in between sessions. All this stuff is super important. So even if you don't have an Oura ring and you don't have a Garmin, you could, if you purchase a heart rate monitor, right, or a finger stick, like
I say like an Apple Watch,
the thing about it is the sensor in the back isn't as accurate.
unless it's expensive now.
Even that it's not they're getting better, but it's not like this.
With you, yeah, the wear rings better.
Yeah, because it's much closer to the endings. Yeah. So one of the guys that's he's on the consultation development staff for he's a consultant for Aura. His name is Marco Altini, and Marco Altini has done extensive research on HRV, and he has an HRV app called HRV for Training. I think that's it. HRV for Training. So basically, you can take your HRV and you can it's heart rate variability. It's basically what the variability is in between.
Using HRVs. Not together. Continue.
That's not variable. So,
Yeah, I'm considering Oura Ring because I can't sleep with my watch on,
yeah.
and I feel like that might be.
They got a great deal. Aura, I have no royalties from Aura,
But if you're listening, we'll
yeah,
content.
yeah, Aura 4.0. Their ring is like $249 right now. Yeah, it's a great deal. If you want a Garmin, Garmin's got a screaming deal right now on Amazon.
I got Epix 8.
Yeah,
That's a watch?
yeah.
On the Garmin.
Which watch do you have? Mine's a GPS one, yeah.
You have a Casio with Mickey Mouse
With
on it.
the calculator. I got the white one. I don't know.
Yeah, you have the Garmin Inspire or
It's older.
something with high.
So like the Garmin is like a Vivo was for like the baseline.
I have two Garmins, and Garmin 445 or 26.
Yeah.
And I have the Garmin FX 8.
I'll just like give them numbers.
Like
Zeppelin. Zeppelin 4.
Well, because Led Zeppelin is one of the best bands ever. You don't need to call something special. But for marketing, Frank, you probably need to differentiate. Okay.
Yeah, there's probably more drugs.
with Zeppelin.
You know why they call them epics? Because the battery life is so long, you can go on epic adventures.
So, dude, that battery at the 52 mil, that battery lasts me over a month.
That's interesting.
Because I don't use it for notifications. I use it strictly for training.
Okay.
So running, I don't like my emails, text messages, none of that comes through.
Yeah.
It's up, I think it's more than a month. Probably close to 2 months when battery lasts.
I think it was 8. It's fun.
The only time it drains battery life is when I run connected to GPS.
Yeah.
That drains the battery. Not even the art breakdown thing. That's pretty good. Yeah, someone run actually.
So, but I think that's super important because when we coach people, or when I used to coach people, I don't do it anymore because I'm basically in the business, is that I will consult with people based on their training programs, but I won't effectively just coach them. Is that we take that data because that all plays into how people are responding to training. So people always think that more is better. Mm-hmm. So effectively, better is better. So if you are not necessarily targeting the things that you want or you need to, and you're missing the mark, you're suboptimal in your training, and basically your time can be allocated differently. It's not like a waste of time. It's just that you're being suboptimal with your time. And people have so few hours in minutes to be able to train. You want to take and spend that as best as you can because that is the most valuable currency that you have. And you want to get everything out of all those minutes of training. So if you're not necessarily ticking the boxes that you think you're ticking because you're not necessarily measuring, it's challenging. And not only that, are you recovering better? Because when we talk about training, rehab, performance training, we're training from an endurance standpoint. No matter what you're training for, if you're putting a stimulus on your body, that it's in itself is not going to make you better.
Yes.
What happens is you put an effective stimulus on yourself so that when you recover, you adapt to your training. But if more is better is your philosophy, you are leaving a lot on the table and you're cruising for either injury, overuse, fatigue, because you're not effectively cycling how you are responding to training. And if you don't measure how you're responding to training, you're leaving a lot of performance benefit on the table.
Data, recovery.
Yeah. A lot of times people, like, for instance, like, if you're like Katie Dewalter, right? And she goes out and says, like, how do I feel today? I'm going to go eat some tacos and go 100 miles. I think that's fantastic because she's been doing it for a while. It's not necessarily how you go about doing it.
And she knows her body.
Oh my God. Are you kidding me? She's amazing.
Yeah.
Yeah. So it's those types of things. Until you understand how you respond to certain stimulus, you've got to take a look at it and you've got to record it. You can be recording in a journal, like back in the 80s, right? Like, what ways did I do? How did I respond? So, I sore shit. My shoulder hurt. Well, you know what? I'm really not changing after a couple of weeks. All right. Well, then now you know you gotta jack it up a little bit or pull it back. But I think that, with technology, we have paralysis by analysis. We have inundated with data, and you don't necessarily know what way is up or down because there's so much out there and it's doubling every day. And the advent of AI is super helpful, but you can't necessarily trust it 100%. Utilizing these types of strategies to be able to disseminate all that data, distill it down to usable form, that's what you pay for, right?
Paralysis by analysis. You weighing that shit down.
Yeah.
So speaking of technology,
Yeah.
do you use air purifiers?
Oh, yeah.
Where?
By the cat's litter box.
Put one in your bedroom.
I think that one there too.
One in your bedroom. I have them throughout my house and not in my bedroom.
Yeah.
And I found one.
Which is weird. They should just be in the bathroom. Like, should I tell
What's that fan is for, Frank?
or a big ass like picture one.
You need like industrial.
God,
And I need the attic fan. Do my bath.
Frank, if it's that bad, you got to change your diet.
It's paralysis
I
by smell.
I bought a car with leather seats because of it.
I bought a car because leather seats good for you.
It's probably air conditioning too.
It's vented. They're vented seats.
Yeah.
Of course they are.
I'll induce by rolling.
No,
Yeah, so you found air filter.
yeah, someone told us, and I was like, why didn't I think of that? I spent 8 hours or 6 hours, whatever, in my bedroom. Why not breathe the clean air?
Oh yeah.
So that I'm going to just give you.
Speaking of that, do you sleep hot or do you sleep cold?
I like it cold. Well, I like outside temperature to be cold so that I can bundle up. I don't like it like hot.
So what's this? Because I've been trying to fall asleep. I want to move hot, but I go to bed, kind of shut the heat off when I get in bed.
Yeah. So ultimately, you've got to drop your body temperature in order to be able to get to sleep.
Mm-hmm.
Right. But if it stays hot, it's difficult to get to sleep. So we had 8 sleep mattress. We had a technology layer, which kind of you could personalize your basically your sleep cycles based on the temperatures. It'll cool you down. So I spent a long time trying to get my wife to be able to sleep cool. Now she'll like windows open, she's like shutting the vest down. Right.
I like it.
I come in there, right. The problem is there's like 2 comforters in the bed. I am freezing my ass. I'm like, good for you.
Yeah.
That's right. So I'm out there, I got like a sweatshirt on, like wool socks, going out there, wake up at like 2 o'clock. What are you thinking?
Down comforter is good. I have a Doc down comforter. Man,
Yeah.
that thing is actually thick. I haven't snatched some more.
Oh yeah.
And then our Tempur-Pedic mattress has the cooling layer on top.
Yeah.
Man, that's another thing. I have found I know it's not cheap, man. And, I don't have a lot of money. I didn't go outright and buy it. I did payments on that. And, but anyways, the Tempur-Pedic mattress got rid of my back pain. Both my wife and I used to wake up in the mornings and having back pains like this. That was immediately. That was he got rid of my sciatic thing.
Yeah.
But, and when we switched to Tempur-Pedic, it's expensive, but for quality of life or for my health, it was true.
Oh, yeah. Well, think about it, right? How much you spend on my car?
That fucking thing is still flat after like 12
Oh,
years.
my God. Yeah. Speaking of that, that's what
12 years and flat.
oh my God! Like so we have the bed we got right now, right? I think it's like there's obviously a manufactured kind of foam mattress, right? So like I'm in there, I'm like, why does it like? I feel like I'm like sliced along on this edge of like cliffhanger. I was like falling off the fucking thing. I'm like, why is it like that? I don't understand. Like I'm not that. I'm big, but like I'm not like depressing this foam.
Oh, I could be right on the edge, and the edge will stay up, and I'll sink like right in. And you can lay
I
down.
get better. The mattress is like 8,000 pounds.
You lay down, and you slowly feel your body's like sinking into that shape.
Yeah.
And it's not super soft. It's like medium.
It's like a human taco.
Yeah, you can't.
Yeah, but it's good for alignment of your spine and neck. My pillows have to be too.
It's like when Homer Simpson kind of sinks.
Yeah.
That's what it's like. But it's just your mouth is just right
I
there.
really got a snorkel. No, my dogs, I love them, but man, I have all 3 dogs in bed with. Oh man. Yeah. Yeah.
It's watch, like 2075, we're being less like this cooling, like you're this sack of like this cooling fluid, and you're just sitting into it. Like, I'm going to bed. And you wake up, you like find your way out of it.
You know what I want to try? I've never done this. Is float tanks. Have you done it?
Oh my God, yes.
You've done it. How is it?
I didn't. I mean,
Were you able to relax?
I was doing that, so I'm completely naked. So like you're floating. So like
I don't
parts
think
of
you're supposed to do this.
well, parts of you were outside the water, and like so that part is cool. Because my
Yeah. Why, your knees?
yeah,
You're fucking separated
because they're longer than the rest. Like
Your knees just popped up.
I'm held like a thumb. Yeah. But yeah, like my periscope was hanging out. Like, and it's
So you're all naked there? So what do they do between people? Do they like dump the water?
There's a filtration. So they're going to recycle it through.
Right. I'm going to look first thing every morning. First one.
I'm peeing in your.
Well, it's amazing because you know how much salt you have to put in there to make it buoyant because it's supposed to be at body temperature. So it just feels like you're like animated. You're like just suspended in this.
So I've heard feedback where people had their first experience. They had a hard time relaxing every muscle.
Fuck, no kidding.
They're like, what the fuck is going on?
Yeah, because you have the camera focus on it.
Dude, it feels like you're.
What is a camera? I was going to say, you're like naked while there's a camera.
I got pigeon zoom.
There's probably a category in porno websites.
There's a marker for that.
But it's probably been done before. But it's like, I think it's around the same philosophy of like being back in the womb for like sensory deprivation because it's so difficult. You go a couple of times, all of a sudden you're able to start to like go in. Right? You throw like put the music on, you're like just chilling out. It's so hard. It's like meditation.
What does it heal?
It's your nervous system.
The nervous.
It's addressing your nervous system because you outlined it right there. Because people are so sympathetically dominant, which is the fight or flight mechanism of the body. Because we're so stressed out, we're always going to the next thing. We have such a hard time sitting there and being bored. We have to have we have to always search for that dopamine hit. We have to search for our phone. We have to scroll on our phone. I'm guilty of it, right? Because you're always going from task to task to task. There's always something to do. You cannot shut off. You ever have a difficult time going to sleep?
No.
Right? My mind's like a pinball machine, right?
I get different levels. So level 1, like the going to sleep is when high level of stress. So high level of stress creates anxiety when I'm laying in bed and just sweating. like decided to hot up. And my anxiety is high, and I'm just sitting, laying there sweaty.
Your $1 million mattress won't fucking pull you up.
No. And so I'm freaking out. And all it takes is for me to just go downstairs in the office, bang out a couple of things off my list, and that relaxes my mind. Then I can go back to sleep. The other part of it is I was sleepy, but I was busy doing something when I fought through that sleeping period. Now I can't focus. Now I'm up 3 in the morning. I can't fall asleep. And I try to do things like read something or, be able to fall asleep and just one lie down and fix it.
Yeah.
And I have.
When we talk, we text each other something. What are you doing? You.
Yeah, like, I'm like, why are you up at 2 in the morning? He goes, I can't sleep. I'm like, me neither. So,
I was like,
but we're right next to each other, so sweet.
and you don't know how much.
What's that?
It's like, so all the one of you's like on the side, you're like back to back.
I like send him a text on here, but you hit send.
No. To yourself. No, I'd be like up like 2:30 in the morning. I'm taking a shit. Like, maybe text spring.
What?
And he responds. I'm like, why you up?
Why are you in the toilet?
Yeah, why are you texting us?
Well, no, you. Frank's, why are you in the toilet? I didn't even tell you.
I'll take
pictures. I'll be right over. I'll be right down the hall.
You woke me up when you got it.
Yeah. You're a fan.
What is wrong with it? I mean, you guys have great relationships. I'm happy.
No, but those are the reasons why I can't fall asleep.
Right. So that's the thing, right? So people cannot unplug it because we're on our phones constantly.
And I have the night light mode on my phone where I get rid of the blue light.
Oh yeah. So I try to stay out of that. Like, the only time I'll have my phone in my room is I'll put on my Aura ring because Aura has this relationship with like Headspace for some of their meditation. So I'll do a sleep meditation, put the phone down, flip it over, pop my earbuds in, and then just fall asleep with it. And I'm really trying to get in the habit of doing that. Try to cool down before. Like I won't watch television. Even maybe it might be like a podcast, like Bruce and Banter. Right?
There you go. See, this is earbuds. Remember, you get me problem with that. You Delaware. What? I've never heard of anybody supposed to be with your dog.
I don't know. I didn't want dollars too.
Yeah, I mean, what are you going to do?
So as long as you listen to Bruce and Banter, I'm coach. But another thing I tried recently is I bought those masks that massage your face or on your eye, your ear, and your temples. I love that.
You know what I bought? I bought a massive mask. It's kind of goes around. Instead of like it doesn't have like the sophisticated eyeball massager like you're talking about. It just kind of lifts the mask away from your eyes, and you could have like built-in sound into these masks, so you can Bluetooth associate with your phone. So you don't have to use your earbuds because they tend to fall out and find it in the morning, which is a pain. But that I feel like those situations are really good. The only reason I use that is for noise cancellation, and that's it.
And that mask, like the best of an advocate.
I need a blackout mask.
No, this what these are.
Oh yeah, they're great.
It covers the entire face.
Oh yeah,
even not like entire face, right? From like your nose on. It's like ski goggles.
Yeah.
It's like that. It's got a hinge in the middle so you can wrap around.
Yeah.
And different modes of massage. And with an app, you can also play some theme music or maybe ocean waves, whatever. Listen to that while it's like it's real and it heats up too.
Oh, that's cool.
Temperature control. So it heat up and like
earwax
with people.
Unbelievable.
It's pretty nice, man. It's just banging. You don't see me by that.
Yeah. I mean, that's fantastic that you have temperature control balls in your eyes.
I'm guilty. That's why he's going to the bathroom.
Yeah, they were not mine.
The tea bag.
Adam.
Just separate them right there.
It was fun. I'm so glad you took time out of your business schedule for your family to get you out here. This was awesome information. I really can't. With every 3 months or so, I get status update from you and your growth, and I love it. Just we always want to support our local businesses, and I'm really happy for them. And just what you've been doing and how and that state of the art and unique program that you put together. And I love seeing people around me be successful and grow and see the passion in them and their ideas come to reality and how that affects other people around them. I love it.
Well, Roman, I mean, you're a big, I can't thank you enough because when I sat down and I was in a really, really bad place when I left my previous place. And, when I sat down, it was the year we had Dylan, and I'm sitting there and I'm business planning and taking it through. And I called you, like, Roman, this is what's happening. Will you help me do this? And we're out there. I got a newborn at home. We're taking down walls till like 1:00 in the morning. Like it was him and I that did this day in and day out for hours and hours.
Laying back.
Yeah, pulling up like tile and taking down walls and fixing problems and me making problems and Roman fixing my problems. But that just kind of me changing it because I just have a different vision about how things should go. And
like bolt the equipment down and goes shift them over and like nothing fun. I just drill holes in the concrete.
Yeah.
Anchors.
Yeah.
I'm shooting.
No, in that sense, because that's happened.
Yeah.
But the thing about it is, like, having people around you that, like, I really have a hold a close circle of people, and I want to have people around me that'll one, hold me accountable, be uplifting, and then we can service each other, right, and in the most positive way. And having that circle and having a small number on that circle is because, especially nowadays, the amount of close people and friends that you can have is becoming less and less and less because everything is becoming more superficial and comparative with other people, especially in the era of social media, because people equate themselves, judge themselves on other people's, the way they portray themselves on social media, which often isn't true. It contributes to depression. So having people to go to that is going to be there to help you out and be successful is incredible. So I would, having that journey, having your support and help me out would never happen.
I'm on each other.
And, because you're a stand-up guy and the work you do is impeccable and you're timely, you're honest, and there's not a lot of people that continue to do that. You hear stories all the time about people signing up for jobs and taking the cash, right? So that's why you're successful.
When you told me about your vision, I saw the vision and you were nervous and I said, Adam, I see what you're trying to do and it's amazing. And I think that you have all the tools you need in your head around you. Just do it. And I remember when we got to Rochester, we were having this discussion. I want to be successful. And I said, boy, if I'm successful, like you be successful. You set your standard of success. Don't worry about those letters. I often look at some of these successful people, we call them, okay, like rich. Are they, like, you could have a lot of money, but are you happy? Is everything perfect in your life? You know what I mean? So I feel like success we need to measure based on where we are. Are we like happiness should be the measurement of success?
Yeah, I think happiness. I think fulfilling. See, like, well, it's interesting you say happiness because happiness is a state, right? You can come in and out of happiness, but if you work on a purpose-driven life, that you feel like you have a calling, that you feel like that you are making a difference and that you are really passionate about that difference, then that can check a lot of boxes for people because you can be happy, but you can be sad. There's a lot of different emotions that are around you that you'll experience on a daily basis, weekly basis, monthly basis. Life is relentless. It will continue to punch you in the face, right? And
life is hard. I say life is hard.
Yeah, being resilient. But if you come back to something that you enjoy, that you feel like you're making a purpose, you have fulfillment out of, then continue with it. I was listening to Scott Galloway talk. Scott Galloway is a teacher. I think he's at Harvard, and teaching like Harvard Business School. And he's talking about like one of the biggest bullshit things is following your passion, right? Say, well, listen, you can, because that's not necessarily going to lead you to a fruitful life. You might be just a Sam, but if you follow the thing, you have your core values, and you establish what those are, and then you create something that is in alignment with your core values. I feel like then you'll feel fulfillment, and then that's when you can bring that type of environment, that type of thought process to the market. It's something that you are genuinely interested in, starting as a side hustle and then moving on. For me, with this, like, this is a burn the boats. It's like when you have a new baby and you quit your job, where are you going? Mm-hmm. It's like you're dedicated. There's nothing stronger of a pull when you feel like you have a cause, especially for me. For anybody that knows me, like I'm intense. My patients become intense because I equate to this so much, because I feel like this is who I am as a person, right? And I'm very passionate about it. I'm very passionate about helping people. So the amount of inertia that you have with that, because when you're in a situation like that, I was listening to the Ruszkowski podcast like 2 days ago about this, and you start something, you have this conviction. Like, for instance, you talk about when you're going to Buffalo or going to Rochester to pick up a piece of equipment. You have doubts, but you got to be your biggest cheerleader. So there will be people that will tell you you are not going to make it. They will start filling your mind with bullshit. They will start. But what happens is that you have to turn away to that. Those are forms of resistance. If anybody has read the book by Stephen Pressfield, like Resistance or Going Pro, or Turning Pro, that is a tremendous short book that will teach you about the forms of resistance and how it will impact your creativity and stifle your success. Mm-hmm. So taking that and then empowering you, say, listen, I will turn my back to that because I choose to keep on pressing forward. I believe in the cause. And then you start to have little wins, and it fuels the fire.
And prepare yourself to maybe have failures along the way, but not to be discouraged to surrender. But the failures are tools of learning from.
Exactly.
I tell myself, like what you were saying, and tell my son not to automatically accept it and that you're going to fail at something, but be prepared for it. So if you fail at something, don't just give up. They just learn from that mistake and then sell it.
Because failures are the greatest ways that you can learn what direction you need to go. Because if you are adverse to failure and that's going to be a stop point for you, you will never make it.
Yeah. We were driving. He said, how did humans come up with planes? Like, who told them how to build a plane to fly, right? And I said, my exact response, through many failures. And he's like, what do you mean? And I said, we had an idea and then we built it and we crashed it. We learned from that. We built another one. We crashed. And so on, physics and knowledge that we acquired over time through many failures, we came up with that.
To me, it's the same thing. Nikola Tesla, right? We're circling back to his inventions. The invention of the light bulb. You know how many times it took him to create a light bulb? Thousands. You know what happened when he finally did it? It's like, I stole it.
Yeah.
Right? You think, it's like, I just learned 7,449 ways of not how to make a light bulb. Mm-hmm. But you gotta stick to it. Obviously the number is different, but you get the point. But those types of things, you find the ways to make it work. So you take the knowledge. It's like the old Bruce Lee quote, right? It's like you absorb what is useful, you discard what is useless, or it doesn't necessarily benefit you. And then you learn from all of your experiences. I am very perceptive. So I learn how I wanted to treat people, how I wanted to treat my employees, how I don't want to be treated.
Yeah.
How I never want to expose my employees to certain circumstances. Mm-hmm. How I want to be able to empower them. How I want to create an environment for them from which to grow as a person, from which to grow as a professional, to provide them the ability and environment from which to learn in a psychologically safe environment. So they can feel like they can make mistakes, to close the gap of how long it will take them to adapt from making mistakes. Because for me, I may make mistakes. There's different learning styles that I had, but there was a longer gap of which I had to navigate before those mistakes were immediate. I want to help people experience that because they need to, and then close the gap on how fast they need to learn from it. Because that will help them to move forward. Because now, standing on the shoulders of giants, right? So if you stand on the people that have come before you, but they're willing to help you, I mean, that's the best thing. Yeah. So it's to say, and that's what I want for my employees, because if they grow and they feel like they have purpose, they feel that they want to come to work every day, they will go to battle.
I appreciate it.
Exactly.
Appreciate it.
Because they know they're in an environment where they feel safe and they get a supreme amount of knowledge. They feel supported. They feel like their opinion matters. And they don't feel like their back is against the wall. They don't feel like somebody's going to come to get them. They don't have to bury their head. And they feel like, I'm afraid to do something because I'm going to get criticized for everything I do based on old school mentalities. And that's not how I operate my organization, because the people come first. The people that treat those people come first. And then that irradiates into the culture that is provided inside the clinic. Because you can have all the knowledge, but if your culture is poor, you'll start to have a cancer that will grow from inside. And then all of a sudden it will erode and you will have nothing.
Then it's true.
And then it's done, because it's difficult to walk that back. But guys, I really appreciate you so much. You bringing it out. But if anybody wants to get a hold of me, they hear this locally or from afar, they feel like they're in a bad position, or they feel like they're getting suboptimal results, you can get a hold of me at Adam at ar-physicaltherapy.com. Visit us at www.ar-physicaltherapy.com. Please reach out to me. I'll get back to you. You can email me. Yeah, it's 315-932-5210. Please, that's on.
We'll also have the description contact information in the description of this episode.
Yeah, we're in the process of building some big things, and I'm really excited about it. And I'm really excited to bring this to the community. And I think this is going to be a tremendous couple of years. And I'm really happy to be able to share with people.
I'm excited for you. I'm looking forward to seeing the changes. Happy for you. That's you growing. Come back here. Tell us more about the new bank.
This is great. This is great. I really enjoy it. Oh yeah, this is great.
You nervous a little?
I was curious on how I would kind of get off, but I mean, once I get talking, I can just go with things. So it's really fun for me. But we took it a bunch of different ways. I just like organic talking.
We don't script anything here. We like to be straightforward with our guests. We want them to feel relaxed. Scripts put a little stress on people and trying to remember. I feel like the more organic it is, the more we need to pay attention to each other, as opposed to being distracted in our minds. And it makes a better conversation. So thank you again, Adam. I want to thank all the listeners, followers. We appreciate you. If you want to support this podcast, you can buy our merchandise on Pantherstore.com. Helps us to keep going. It helps us fund and bring people like Adam and others, and some people call us. We go to their location. Those are all expensive. All the equipment costs money. And we love all the feedback we get from you guys. So all of that really helps too. If you want to keep this podcast going, we enjoy running Go. Thank you, Optum Network, for also helping take this podcast. And again, thank you to Big Oyster Brewing Company, level leading for veterans and people locally. They support organizations, so thanks to them as well.
It's interesting, right? So what I'm thinking about doing, is if we could have almost like a segment right? And like you said, listen, you can mostly poll your listeners. You can say, hey, let's get a question, like a question bank going. You say, listen, we'll bring it on. So we'll answer like either therapy, training, nutrition questions, like on your website, and then bring it on. And we can make it like this, like almost like a Q&A, like something like that. Yeah, that'd be cool. Just to kind of get the pulse of what people are looking at. There's so many different things on social media now. I'm just curious on what the pulse is on people, what they're looking for.
Sure. Thank you, everybody. Thank you.
Thank you.
Thank you.
Avoiding your unfinished home projects because you're not sure where to start? Thumbtack knows homes, so you don't have to. Don't know the difference between matte paint finish and satin? Or what that clunking sound from your dryer is? With Thumbtack, you don't have to be a home pro. You just have to hire one. You can hire top-rated pros, see price estimates, and read reviews, all on the app. Download today.